Hello, hello, welcome. Thank you folks for joining us this lovely April evening. You know, when the sun is out, it can be difficult to be in front of a computer screen, so we really appreciate you taking the time to connect with us today. For those of you who don't know me, my name is Lily Talcott, and I get to serve as the Deputy Superintendent for the Ithaca City School District. And with me, almost as always, is, go ahead, Carrie.
Good evening, everyone. My name is Carrie Burke, and I'm the Coordinator of Health Services and Wellness for the district.
And this evening, we are sharing information regarding the updated guidance from the New York State Department of Health and our anticipated approaches here in the Ithaca City School District. And we're very much looking forward to connecting with you all and answering your questions. Please send your questions directly to Emily Tracy Arm, and she will be collecting them. And once we're through our presentation, we'll pause, we'll stop sharing, and we'll just have more of an informal discussion regarding the questions that you brought up.
So as Lily indicated, our agenda for this evening is to review with you the updated guidance that was issued by the state just a little over a week ago, and to discuss our plans with respect to that guidance and to allow time to attend to your questions and thoughts. So to begin with elementary, the state guidance has adopted effectively the CDC guidance, which recommends 3 feet of physical distancing in a classroom setting and 6 feet for those engaged in instrument music, whether it's playing instruments or singing. These activities, of course, are occurring while persons are masked. The CDC guidance and the state guidance have both eliminated the need or the use for barriers. They've also advised with respect to transportation that we can look to increase density on buses. In our case, we're looking at seating 1 student per seat on a bus, which will allow us to transport more students to school sites. And in terms of our timeline, we're looking at welcoming students to return in person on or around April 26th. This timeline allows for transportation, for example, to look at routes and to ensure that we can transport students who are returning in person to school safely. And then finally, welcoming remote staff to return. So we have been in touch with staff who have been teaching remotely, many of whom have had the opportunity to be vaccinated. So we're welcoming those staff back into our buildings.
In terms of secondary schools, you'll notice the guidance is actually rather similar, right? We'll talk a little bit later. Carrie will discuss there are different thresholds of community spread that impact some of the distancing requirements. But an important note over here to the right, is really that we're welcoming remote staff to return. And we just put a letter out to those staff who are working remotely to update their need for medical accommodations, and that we need that information to be updated given the widespread vaccinations. You know, we've learned recently that our county is one of the top 2 counties in the state in terms of the folks who are eligible for vaccinations, who are actually receiving them. So we've been really, really impressed and so lucky to be in Tompkins County, where vaccination availability is so widespread. And thus, we've really worked closely again with educators, with our collective bargaining folks, and are welcoming those folks back in person. Once we have that information, if there are any continued medical needs for our staff, then we can finalize really the staffing pattern, which will then allow us to determine the number of students that we can safely fit within our physical spaces, given the 3 feet of physical distance between students. We anticipate that this will be in early May, right? And that timeline and all of those details will be forthcoming as we gather more information and understand really who is returning in person and who is still unable to this time.
So we're here this evening in part because the State Department of Health likes us to ensure that we are continuing to communicate with our community about shifts in guidance and shifts to our instructional approaches with doing school during a COVID pandemic. And so we appreciate you being here this evening. We welcome your input and thoughts, of course, during this session, but for some reason you don't have the opportunity to submit your question or have it answered, please feel free to reach out to us via our Let's Talk portal or to email either one of us directly. Now we're in this space in part because of local transmission rates, which are low, which is just such a wonderful place to be. And that's in part because of the efforts of our county health department and you as individuals who have been so diligent about following the public health recommendations and measures. Currently, we sit in a place which the CDC describes as a low risk of transmission, a low rate of transmission, community transmission, based on thresholds and indicators. So for instance, our 7-day average test positivity rate is under 1%. And we currently, our new positive case rate is 9 cases per day. That's a 7-day average, which puts us, again, in that low transmission category. The other piece that was heavily emphasized in the guidance is all the work that has been done by researchers and scientists in the United States and across the world, pointing out the importance of ventilation and filtration. So those things have been adopted both in the CDC guidance and the state guidance, and we continue to work closely with our HVAC vendor, which is Trane. We have been staying current with the replacement of MERV 13 filters. And I would add that actually our work with Trane very early on in the school year is serving as a model for their engagement with other districts that are looking to upgrade and improve upon their ventilation and filtration systems.
So we received a great number of questions about what's on the horizon. So what happens after this spring, right? We are obviously trying to welcome back as many educators and students, of course, as possible in person. Those students who wish to remain fully remote certainly can. We also did receive that question as well. But then we've also received questions about what's the plan for the fall, right? What's happening ahead, right? And the learning models, the specific either hybrid or fully in-person options are being determined. Of course, right, we're working through a great number of plans, but we're also collaborating, as always, very closely with our union leadership as well. And we're awaiting New York State guidance, right? So much like last year, we know that there may be guidance that comes out at an inopportune time, perhaps, over the summer, but we have a sense of what some of the options are. And of course, Carrie and I, along with a great number of others, are staying very tuned into what's happening throughout the Northeast as well, so that we can get a sense of what may be coming our way, right? So what's happening in Massachusetts and Connecticut, et cetera, as well. But then folks are really asking about teaching and learning in the fall as well. And some of you were able to join us at the board meeting on Tuesday and have a little bit of a sense about our approach. And some folks have asked about this idea, and I'm sure you've heard a lot about this idea of the COVID slide or significant learning loss within our community. And we actually pause on those phrases, right? We take note that both of those ideas come from a deficit mindset, right? And that they actually don't do our young people or our educators very much of a service, right? Our educators have been working harder than many of them ever have. I know I am, right? And I know that our teachers and our education support professionals are as well. And you know that our students are as well, right? And so our looking ahead is really toward an asset-based approach. We also know that when our systems are stretched or stressed, that we tend to revert back to habits that may actually be more harmful than helpful, right? So when I'm really stressed, I tend to eat a lot of onion rings, right? Not healthy, right? I know it's not okay, but it tends to be where I go to. So our system as a school district, our system when it's stressed, we may tend to revert back to further segregation and remediation, further skill and drill for those students who are quote unquote not ready, as opposed to taking a just-in-time approach, right? And giving kids access to still rich and rigorous and interesting content and skill-based learning. And we know that those outcomes tend to be racist and classist, right? And we want to avoid that as much as possible. So what are we talking about? We're talking about learning forward ICSD. There's 4 main tenets, right? We're looking for students as leaders and partners in the curriculum development process and in this educational process, right? We may do that informally, and we're looking at creating systems to do that well. Educator identity work. Each of us as educators are re-entering the school year with a great number of experiences and challenges that we all have faced, right? And so allowing time and space for us to explore ourselves, both our intersectional identities and how those connect to schooling, right? To our curriculum, to my students, et cetera. Anti-racist curriculum for all. We certainly had projects where folks have created wonderful units and lessons that are anti-racist and anti-marginalization in nature. And we're really looking at a 3-year plan to allow us all to be in a space where we're providing all of our kids with anti-racist curriculum that both attends to the reality of unfinished teaching and learning, right? As opposed to COVID slide, we like to talk about unfinished teaching and learning, right? So looking at those year-to-year learning maps, thinking about how literacy plays a really key role in this, and not just skills, but things like identity and criticality and intellectualism and joy as well. And then lastly, structures of support. So we've expanded our summer offerings. We're looking at expanding our programming for after school, et cetera. Of course, professional learning opportunities for our educators, and perhaps most importantly, social emotional supports for our educators and for our kiddos and families as well. So we've really been in the midst of planning for this. And again, we're working with a cadre of educators and students in order to really guide and move this work forward. You'll be hearing much more about this, but because we received questions beforehand in advance of this meeting, we wanted to make sure that you all knew we were planning and we've been thinking about this to allow you a window into that as well. So with that, we're actually going to pause because we know you all have a great number of other questions, and we want to spend the remainder of the time really diving into those and giving you time to share what those questions are, and then we can if there's any that we actually can't answer, we're also, of course, Carrie and I are adept at crafting frequently asked questions, and we're also happy to create those as well after this meeting if there are any questions that we're either not able to get to or we simply don't know yet, because that is also the case sometimes in this era of COVID. So Carrie, I'm going to throw it to you. Are there some questions that you see that are coming in? that you think we should start with here?
Yeah, there's a question with respect to students and the fact that most students, particularly students under the age of 16, are not eligible to be vaccinated.
Mm-hmm.
And how are we attending to the safety of students in the school space? And I think it's important to note that the recommendations that are coming out of the CDC and New York State are based on research that have been done in school districts in other parts of the country, Wisconsin, Utah, where they followed schools where less distancing was occurring, between 3 and 6 feet, and the implementation of their various protocols. And what they found in that work, and what we've experienced too locally, is the risk of transmission in schools remains low. That's been the case. We meet weekly with the public health department. We talk to them regularly, and they continue to support that it's not impossible, certainly, to have transmission occur in the school setting, but it's much lower than what is happening outside of schools. With that said, even with the reduced physical distancing that'll be occurring in the classroom, we will still be doing 6 feet of distancing in other spaces, for example, during eating. And between adults, 6 feet of distancing should be maintained. We are still diligently adhering to mask wearing, hand hygiene, and our surveillance testing program continues. And that's an important piece. For example, you may have heard about cases that were identified in the course of this week at one or more school sites. And our surveillance testing program is a piece of that that's helping to uncover asymptomatic cases. So we are still adhering to all the practices that have been in place from the start of the school year, or with the point of testing mid-year. Those remain to be in place. And if things should change, if the county health department or otherwise indicates that they think something is occurring in the school setting that we need to pay attention to, we will do just that.
Thanks, Carrie. I see a number of questions regarding what welcoming students back would look like at the secondary level, and is there going to be a change in model? So the option of 2 days a week in person and 3 days a week learning remotely will still remain. That will still be an option for young people. Wednesdays are going to continue to be an asynchronous learning day, and is going to remain throughout the rest of this school year, right? So our goal is to get as many students back 2 days per week who are not currently in at all, who want to be, right, who need to be, and then also increasing to as many students to 4 days a week as we can, right? That's certainly our goal, and we know that there are of course both physical space and staffing challenges that are associated with that, right? One of the challenges that Carrie noted earlier is that although 3 feet of distance between students during instruction is permitted, the difference is during mealtime, you have to be 6 feet still, right? And we can't utilize barriers. It's just not a replacement for the 6 feet of physical distance. So that's a really, that of course creates all sorts of interesting challenges. Thank goodness the weather's slightly better, because it allows us to be outside much more, which we're really grateful for. And we're being extremely creative about the spaces that we're using, both at secondary and in elementary, to try to make that work as best we can. Carrie, there's another question about vaccinations, and wondering about whether teachers and staff will ever be required to be COVID vaccinated, and just knowing that students, as you talked about earlier, knowing that students may not be vaccinated for some time who are younger than 16, what does this mean for some of our adults, and would we ever require it of of our staff. I'm happy to jump in about that as well.
Thanks, Lily. Yeah, that's an excellent question. At this time, we are not requiring vaccination of staff, and we actually don't have the legal authority to do so as a public entity. Much of the policy around that is shaped by our regulatory agencies at the state level. Certainly you're aware that students have vaccination requirements for school attendance, but as of this point, there's no requirement for public employees. That said, we have indications that a vast majority of our staff who've had the opportunity to be vaccinated have done so. There's indicators both based on the preferential clinics that were offered to the K through 12 population that filled up very quickly for week after week after week. So we feel very confident that most teachers in the district are vaccinated.
All right, there's a question about elementary. We'll talk a bit about secondary, so I'll pop there for a moment. A question about whether our elementary learners who have been fully digital all year, if they return in person, will they maintain the same classroom teacher? So our elementary classroom teachers who are remote. We have, there are a handful, very few of them, you would already know, that are returning in person because they're returning with all of their kiddos, or just about all of their kiddos, right? And there are, so if, obviously there's still a great number of young people in pre-K through 5 who are learning remotely and want to stay learning fully remotely. And so there are, of course, some teachers who still have 25 kids in their class, right? So we're not telling those teachers and those kids that they have to come back. They need to actually remain remote, right? So they're going to be remaining remote throughout the rest of the school year. So the question around whether young people will return with their classroom teacher, again, you would already know that. And so if so the answer in this case likely is no for you, but I'm happy if you want to email me directly if you have a question about your particular child at your particular school, please feel free to email me.
Lily, there's a couple questions here about surveillance testing I'd like to attend to if I could.
Great.
So this may be new for some families who have not had their child attending in person. We implemented a surveillance testing program upon our return to school after the winter break in January. And so the surveillance testing is completely voluntary. It's optional for both staff and students. And the way it works is if you want your student to opt in to participate in surveillance testing, there is there's a form that you can print from our website, actually a link dedicated to our surveillance testing program that talks all about it, but you can sign a written consent form and submit that to the school site. Now, what it involves at the elementary level, we test once a week on Monday mornings. We test students and staff. We seek to test 20% of our in-person student staffs over 2-week periods. So week to week, we're testing approximately 10% of the persons who are in the building. At the secondary level, we test twice a week because of the cohorts. So it's either a Monday or Tuesday or Thursday, Friday at the secondary level where testing is occurring. The tests that are used are the rapid Abbott Binax Now test. So the results, they're antigen tests, they take about 15 minutes. It's a front of nose nasal swab for older students. Many of them can do it themselves with instruction and direction from trained observers. And for the younger students, they typically can access assistance from the school nurse in having the test conducted and completed. So certainly that is an option. And again, it's a voluntary program, as I mentioned. So if you have any questions about that, feel free to reach out to me directly or to consult the information on our website.
Thank you. All right, Emily, just really quickly checking in, making sure that everybody is still, we just got a little bit of feedback there, just making sure that everybody is still, our settings are still the same.
Still the same. It was a fluke.
Great.
Sorry about that.
Thank you, appreciate it. Great. All right, there are a couple of questions about staff returning and what that looks like. So one of the questions was, prior to last week, or a few days ago on Friday, staff who were remote were told that they had a choice to remain remote, or they could return. And indeed, that was absolutely the case. And we, of course, looking at all of the factors, and again, really looking at the great number of folks who are vaccinated throughout our community, and just knowing that we are in this top tier throughout our state, and just understanding how widespread vaccinations really are within our community, really following that thread, and knowing that we have a great number of kiddos who want to return in person, especially at the secondary level. We really wanted to welcome folks back and have them return. If they still have a medical need for an accommodation to be remote, then that would remain. So that's a little bit more of the context that I think answers a couple of the questions that have come in regarding that. Right. There are questions about going from 3 feet to 6 feet within classrooms, and how singing and how meals and all of those things are going to work if both of those things have occurred entirely in the classroom all year, right? How will that work? Which is an excellent question, and it's something that each of our buildings is really working out right now. So on Friday, I'm just at one of the elementary schools setting up where we were going to bolt tarps to the to the side of the school in order to create auxiliary outdoor spaces for kiddos to eat outside, and to also have shelter, right, under those tarps as well. So folks are getting really creative. Folks are using their cafeterias that they weren't using earlier, right? Which is, they're still trying to be very cautious in terms of cohorting and ensuring that we're cohorting as much as possible using those spaces. There are teams who are using the stumps and the buckets outside. You see a lot of our outdoor classroom spaces that folks are utilizing more and more. And again, with good weather, we're able to eat outside. We're able to do art and music outside more and more. And of course, in the rain makes that a challenge, but we've also been really, really fortunate to have the outdoor gear project spearheaded by all 8 PTAs. Oh my goodness, they have raised over $60,000 to outfit every single kid at VJM, every single kid at Enfield, and I believe every single kid at Fall Creek as well, with outdoor gear, and then a bunch of outdoor gear for all of the other schools as well, for those who need it. So everything from splashy suits. If you ever drive by or walk by Fall Creek, you will see outdoor kindergarten classes where they are in splashy suits all day, even when it's snowing, even when it's raining, learning all content and all social emotional skills together outside in those spaces as well. So that's some of the logistics around how that's going to work. And again, each classroom, each building is really working out each of those details. I've signed up to do lunch and recess until the end of the year at a particular school, right? We're all just pitching in to support as we can. There is another question about vaccinated adults being 6 feet apart. but students being 3 feet apart. Can you just talk a little bit about the guidance, Carrie, and perhaps why that may be in the guidance, right? That's not something we decided, that's something that's within the guidance. There's a question about that.
Yes, thank you. Well, one thing to note is that the guidance doesn't necessarily presume that adults are vaccinated. Of course, guidance developed for, by the CDC or the state is probably sensitive to the fact that vaccination rates vary across county and state borders. But it emanates from a place of research, really, what we've learned over the last year, and what researchers have found is that kids are less likely to acquire SARS-CoV-2, the virus that causes COVID-19, as compared to adults. And then the risks for young children tend to be less in terms of outcomes, bad outcomes. So that is what's driving it. And I think, a lot in other settings, I can't necessarily speak to data in Tompkins County because I don't think they've done that level of granular research, but the case studies that have been done in like Georgia or Utah or Wisconsin that were cited by the CDC, much of the transmission that occurred was occurring between adults or from adults to students, and less so from students to peers or students to adults. So effectively, I think that what the guidance is reflecting what came out of the research with respect to transmission in the school setting.
Thanks, Carrie. Appreciate it. All right, there's a question about the rate of students being admitted from any wait lists, and really how we may decide to increase a student from 2 days a week to 4. And right now, our wait list, for lack of a better term, for each of our secondary buildings really varies, right? And in part, especially particularly at the high school, we really work with kiddos who may be slated to come 4 days a week or 2 days a week, but they may be, perhaps their attendance in person has waned significantly. And so we want to connect with those kiddos and check in, see what's going on, and see if they're still planning to come as well. And then we cycle more kiddos in. And so that's been the process up until now. But of course, now that we have more staff who already are planning to return in person, and of course are welcoming more back as well, then that number of students that we can accommodate, both because of space and staffing, would then increase. In terms of 2 days a week, right? We want to welcome those kiddos back first, and it's much like a for those of you who grew up in the 80s, like me, like playing Tetris, right? It's much like Tetris, right? Determining for each class period the capacity, and then determining when you have the number of course offerings that we have, right? Then determining that throughout an 8-period day, or the 8-period day stretched over 2 days, we have to determine that the capacity there, and then go from there in terms of welcoming more students back to the 4 days. As we want to be able to do that as much as possible. And of course, there are some extenuating circumstances. Of course, we've tried to ensure that our students who have individual education plans or 504 plans, students who are English language learners and receive English as a new language services, those students who have significant mental health struggles, right? That the kiddos that we know need to be in person those 4 days, that they're certainly prioritized, right? And as challenging as that may be to hear, that's really where folks throughout the state and throughout the country are at this time. So that's a little bit more about the process. All right. So we've got some questions about the options that are on the table for next year. And as much as I'd love to be able to say, here they are, we actually don't have a clear enough sense in order to lay those all out on the table right now. I can tell you that folks in other states are beginning to put out some guidance, as I mentioned earlier. The Massachusetts guidance has already indicated what they plan to do for the fall, but we still don't know what is going to be mandated for New York State. So again, we're planning for a number of possibilities, but we're you know, we're waiting to for that guidance in order to finalize. There's a question, Carrie, if I can have you answer it, about vaccinated in-person students at the high school level, and if they are ever determined to be a close contact, what does that mean for them? Do they have to stay home for 10 days? Are they then subject to quarantine?
Great question. Thank you, Lily. And this is a trend we expect to keep occurring potentially as students age 16 and older can get vaccinated. So if you are fully vaccinated, which means you've received 2 shots of a 2-shot dose, right? For example, people age 16 years and older are eligible for the Pfizer vaccination, which is 2 shots. If you are received both shots and you're 2 weeks out from that second shot, and within 90 days of having received that second shot, then you will not be required to quarantine if you are exposed to someone who has been determined to be COVID positive. And so that, I know, is a real shift in a game changer, particularly at the secondary level, where we've had, in some cases, to go remote in the fall or even earlier this year because of the number of persons who were in quarantine. So as staff and students alike reach that status of being fully vaccinated, we will have fewer and fewer persons who are subject to quarantine. Now, that said, we still, the health department still likes to reach out to those individuals and discuss with them the fact that they've been exposed, and we will still include them in our notifications as being close contacts, just because of the very rare risk of a breakthrough infection, meaning you're fully vaccinated, you were exposed to someone with COVID, and you still managed to contract it. Now, that is incredibly rare, but possible. So the health department likes to err on the side of caution and advise those persons they've been exposed, but will not require them to quarantine.
Thanks, Carrie. Appreciate it. All right, a couple more questions, and then we are going to close out. I should have said at the beginning that we're planning to end right at 7:45, and we want to respect everyone's time and recognize that folks have families, as do both of us as well, and probably want to get back to them this evening at some point. So there's a question about the process for letting schools know whether they want to come back in person or come back in person now, and be on the lookout for that communication and the process for that. We want to make it as streamlined and easy for families and for buildings as possible. So just be, as I said, be on the lookout on that. And then there's another question that's come in regarding whether families will find out who and which teachers are returning in person prior to determining whether they would like to come back. And we are, that's an interesting question. I think our plan is really just to ask people, would you like to return? I understand that there's a particular challenge associated with kiddos returning and sitting in, say, Q gym for 3 periods in a row in a day. We understand that is not, that may not be what a student expected, right? It may not feel like it's really ideal for their needs, and we understand that. So I think we're going to have to get back to you on that question. I'm going to be honest with you. You know, we really want to know if folks want to come back, and know that there are still some extenuating circumstances for our staff. There's also a question about childcare for our staff and what that may mean. You know, we've really talked a lot about the medical needs that staff may have, and if there continue to be medical accommodations that need to be made, we will, you know, we would require a doctor's note in order to make that accommodation to continue to work remote. And so the question about childcare, of course, is, you know, we haven't necessarily touched that. So I understand that there's a question regarding that. And, you know, I think probably the best thing to do would be, and you know, for a great number of folks who, you know, maybe a few of the folks who asked that question are currently remote people who maybe had childcare as their reason that they needed to be home. You know, come tomorrow. We have that meeting, so feel free to join us then. But I think probably the best thing to do would be to schedule with your union leader and the head of HR to discuss that situation. I can tell you too that I've spoken at length with Sue Dale Hall, who's wonderful. She's the head of the other CDC, the Child Development Council for the county. And there were 7 centers that were accepting for infant care, and 9 that were open for toddler care, right? So toddler through right before school age. So you know, there are some openings, and I understand that folks have really very unique situations as well. All right, Carrie, other questions? We probably have time for one more. Do you want to pick which one, and we can end there?
There's at least a couple questions about the variants that have emerged
Right.
and been identified.
Right.
And I would say, and this is really true of this entire school year, is that if the county health department were to alert us to something occurring, particularly in the school setting, we would pivot. That has been the constant through this entire school year, really, is change, adapting and change to whatever's happening in the community. For example, standing up a surveillance testing program. We did not start the school year with one. In January, we decided to implement one in response to what we were seeing. And so I know the county, there's surveillance occurring around the presence of variants, that is something that is actively occurring. But with respect to what's happening in the school setting, we maintain close ties and contact with the county health department and other schools in the county. And if we saw an issue or concern emerging, we would certainly rethink what was happening and revise our approach.
Absolutely, well said. And Carrie, I'm glad we're ending on the note of shifting. Right, that has certainly been our constant. Carrie and I have been at this together as we all have, right? As the community of all of these wonderful people whose names I recognize well, and some of you I grew up with, or grew up with your kids, or taught your kids. I recognize many of the names on this call tonight, that we've all been in this space of constant change, right? This constant change these past 13 to 14 months. And we recognize both that it can be exhausting and very painful for a great number of folks. And I'm also, you know, I've been extremely grateful to, again, many of the people on this call. I see a bunch of the teachers and families who are just such extraordinary people, and we've been in this together, right? And truly feeling like we're in this together. So thank you. Thank you for your support. Thank you for pushing us. Thanks for keeping us focused on the kiddos. We certainly appreciate all of your engagement and all that you're carrying and doing for our community. So if we didn't get to your question, we're going to be working on an FAQ, and we'll pop that up on our website as well. Appreciate you all taking the time, and be well. Take care of yourselves. Thanks a lot. Have a good night. And thanks, Carrie. Nice job as always. Appreciate you.